So hello, everybody. Welcome wherever you are joining us today, whether it's your morning, lunchtime, evening, we welcome you. My name is Haley Campbell. I am a project director at the Global Consortium on Climate Health Education based at Columbia University. And it's my pleasure to welcome you today to the May Member Learning Collaborative webinar. So if it is your first time joining us at one of these sessions, the GCCHE webinar series on the Learning Collaborative aims to kind of dial in a conversation to provide opportunities for our members to share and learn about strategies, challenges, and success stories of integrating climate and health education into health professional curricula. So just before we get started, a little bit of housekeeping. We do have live English to Spanish interpretation today. So depending on which language you want to listen to, you can select the interpretation button in your bottom toolbar. It looks like a globe icon, and you can select if you would like to listen in English or Spanish today. So today's webinar will have a very specific focus on medical and physician education within the lens of climate and planetary health. And we'll begin with our institutional presenters. We'll first be hearing from the University of Rochester Medical Center, followed by the University of Pittsburgh Medical Center. And our session today will culminate with a question and answer session. So if you have any questions for either of our institutional presenters today, please be sure to write them in the chat and I will collect them throughout the session. Great. So today we have two very exciting presenters who will be sharing their climate change and health curriculum initiatives at their medical institutions. So first we'll hear from Dr. Valerie Liu. Valerie is an emergency medicine physician and the faculty of University of Rochester Medical Center. She completed her medical degree at UC San Diego and her residency, master's in public health, and international EM fellowship at URMC. She completed a diploma of mountain science medicine in 2019 with the Wilderness Medical Society. She's a former Denali Park Ranger, yoga instructor, and mother of two. She can usually be found in and around the water, canoeing, swimming, or surfing. Oh, wow, I love that. She has a special interest in climate change and human health and is committed to helping the healthcare sector develop climate resilience and environmental responsibility. So welcome, Dr. Liu. And second, we'll be hearing from Rachel Wojcik. Rachel is completing her pulmonary and critical care training at UPMC, where she will be staying on as an assistant professor, as well as having completed a master's in medical education at the University of Pittsburgh. She's interested in educating physicians on air pollution and climate change's impacts on human health, in addition to cardiopulmonary physiology and mechanical ventilation. So thank you both so much for being here. I'm really personally excited to hear both of your presentations, and I guess I will pass the mic over to Dr. Liu to kick us off.
Thank you for that introduction, Haley. I realize it's actually been a while since I wrote that because now I'm a mother of three. I also have a 1-year-old now, so life has, as it does, gotten even more busy. But I am super stoked to make time for this and talk to you guys. So my day for the most part is filled with education, mainly resident education, but I also do a fair bit of medical student teaching and run seminars for some nursing, patient care techs, and other people that I work with. But this is meta because I get to help educate the educators now. So yeah, really exciting. I am going to pull up some slides because when doing Zoom, I find it really helpful to have these visuals so I don't feel like everyone's staring at my face. Okay, so I'm going to talk to you guys about planetary health. And right in this title slide, I'm going to give credit to one of my former residents and also a physician who had completed a fellowship in climate and health, Dr. Catherine Weber. So she was a resident when we did this project, and now she's a full-on practicing doctor. So a lot of this, I'd say at least half of what I'm presenting is her work. So she can't be here today, but also Dr. Catherine Weber. So you guys have her name up there. So just some scene setting, and this might be really old hat for you guys, so I am going to blow through this a little bit, but the current state of affairs is the climate is changing, the climate's energizing. There's lots of natural disasters, including drought, wildfires, melting glaciers and icebergs, and also extreme weather events like hurricanes and extreme rainfall that have been really the front line of the news in the last decade. The 10 hottest years on record, including the hottest, 2023, have all been really recent. And it's because of humans. It's because of the greenhouse gases that we emit because of industry, travel, various other sources. And if you look at data from our country, the United States, in 2023, the US Global Change Research Program put out the National Climate Assessment. This was the 5th one. And there's all sorts of change that's happening in every region of the United States. And this is the key message, I think, for us as educators for healthcare, for medical students, and I'm actually not sure what level you guys teach, but climate change isn't something that's happening over there or in the future. It's actually happening right now in every region of the world, and it's affecting human health. So this is something that all healthcare providers need to be worried about. It's an established fact that climate change is harming physical, mental, spiritual, and community health and well-being. So I know that was a bit of a whirlwind. And again, this probably is old hat to you guys, but this is actually something that my main trainees that I work with, residents, emergency medicine residents, haven't really had the space or chance to think about this for the last 4 years. So most medical schools don't have a climate or planetary health curriculum. And despite spending all of their time talking about human health, learning about human health, learning how to do procedures related to human health, one of the main drivers of changes in human health, they have not been studying. So my hope is with the work that I'm doing with some of my resident helpers and fellows is to change that in the sphere that I have a little bit of influence in, which is the University of Rochester, and talk about planetary health, which is the health of human civilization and the natural systems on which it depends. The objectives I have for this is describe how we can assess gaps in planetary health knowledge, assess desire for curriculum changes, and create and implement a planetary health curriculum. And the way that I'm going to do that is just giving my little microcosm example of how we've been doing that in the University of Rochester. So the first thing to do, I think, when you're trying to tackle a huge endeavor like this is to identify your allies, which I guess kind of includes, everyone in this Zoom room right now. You're expressing interest in this, and I hope people are looking at the names, taking down faces and names of people that might be close to them that they can reach out to. Maybe Haley will kind of share some of the participant list at some point, but reaching across institutions is great. When I was doing this, I was looking within my own institution and seeing what are existing partnerships that I could use. So some of them were people. It turns out that the University of Rochester's president, Sarah Mangelsdorf, is incredibly sympathetic to this cause and had made like a bioswale in her home, had encouraged tree planting, and made the campus a Tree Campus USA, which was a very good sign. Our Vice Dean of Education, Sarah Payray, as well, had done a lot with promoting climate education. And then some of them were actually not ones that I would have typically considered. It turns out there's a connection with our local zoo, the Seneca Park Zoo, which does a ton of work with conservation and has allies in Indonesia and Madagascar with already kind of climate and health programs that they were running. And academic allies we had are Project ECHO. So I don't know if that's something that you guys have already established in your shops, but Project ECHO is actually a nationwide educational program through, what's it called? Finger Lakes Children's. There's environmental health clinics that are through pediatrics that also have an education arm. So they were a huge ally. And then our organization's already doing local climate work, like the Climate Solutions Accelerator, and our local University of Rochester faculty and staff group, which is Green Reps Rochester, were also allies. But it turns out the biggest ally group I had was our Medical Students for a Sustainable Future. So this medical student run group had only been formed, I think 2 years before I had heard of them, but they were already super motivated and had their own agenda and plan on how they wanted to make this part of their education. So they came to me and asked me and Dr. Weber for help. So what did we do? We mentored our medical students in conducting a needs assessment. So their data and plan for addressing the knowledge gap was then presented to the school curriculum committee led by our Dean of Education. And then it turns out that they wanted a lecture series and also information on how to deal with the pandemic, because this was during pandemic times, 2020. And then my then resident, Kate Weber, developed a planetary health elective for senior medical students. So the idea was that this was going to be a longitudinal curriculum. So again, our first thing was our needs assessment. So we glommed onto this concept of a planetary health report card. And this, again, was also something pre-existing that my medical students had already heard about. And so I helped them do it. So if you haven't heard of it, the Planetary Health Report Card is a student-driven, metric-based initiative to inspire planetary health and sustainable healthcare education engagement in medical schools. And it's self-reporting, meaning that it's not, something like, the Health Commission that comes down from the top down and does it. This is something that is driven internally, which I think is really interesting, again, for fostering partnerships and building relationships within your institution. So the report card has 5 categories with standardized metrics. It looks at a planetary health curriculum, interdisciplinary research, university support for student initiatives, community outreach and advocacy, and campus sustainability. So I thought this was great because it's a pretty 360 view of how sustainability and planetary health is going on in your institution, from connections with the community to research to curriculum. So this, again, is something that is happening all over the world. And this year's report card for planetary health included over 100 schools in 15 nations. And this is its 4th cycle of going on. So this has been growing every year. So what it looks like is students and faculty work together to answer standardized questions, and these questions all have a rating. So this is an example of one of the questions. Does your medical school curriculum address the outsized impact of climate change on marginalized populations? So really dialing down on climate equity. So from 0 to not covered, and 3 is this topic was explored in depth. For us, it was covered in elective coursework, so we got a 1. And after going through all these metrics, your school gets a letter grade. No pass fails here, actual letter grade. So we got a C-. So I'm setting the bar here, and our bar is low. We got a C-. That put us a little bit below average globally and in the bottom 1/3 of US medical schools. So, and you can see here what our categories that we needed work on were. Our curriculum was C-. We really didn't have much going on for research, community outreach and advocacy, student-led initiatives, and campus sustainability. So, I mean, the student-led part was actually our most robust portion of this. But this was actually a real wake-up call for our medical school leadership. Nobody likes being below average, especially people in medical school. So when you can put this up here and as a comparison of your peers, it becomes very real. So we took the in-depth report and brought it to our Dean of Education, Dean Lambert, and had a whole sit down with him on the granular details of how we collected the data. And then we also presented him with our idea for a longitudinal curriculum. And he then became our champion and was able to talk to our curricular committee on how to do a better job. So again, this was 3 years ago that this was done. And since then, our scores have improved because we've developed an Institute for Human Health and the Environment. The medical student group has grown even more, and now we have more of a longitudinal curriculum. So after this report card, we then reached out to the medical students themselves, not just the ones in the medical student for sustainability group, but the whole school. And we polled them about their perspectives on planetary health. Because, I mean, you can have something that you have a need for, but if the students really aren't interested, it's a harder sell to shoehorn this into an already very full curriculum. So this is really the summary of it. How important is planetary health to you today? And you can see it is really, really important to medical students, despite not having formal teaching on this in med school and 4 years of other things occupying their minds on health. They recognize it's important. And then the pie chart on the right, how prepared do you feel to talk to patients about planetary health? Very unprepared. So we had the perfect storm of a lot of interest, a lot of desire, but low preparation. So it was the perfect space for us to insert a curriculum that the students want and that they need, where the wants and needs meet. The University of Rochester is ready for growth. We have all those pre-existing partners and allies that I showed in one of our first slides. And then we targeted then 2 areas where we believe that we can have reasonable efforts that can produce huge effects. So we noted we had a desperate need for an Office of Sustainability. So this is something that we still don't have yet, but we're getting closer. We currently have monthly meetings with another faculty representative. Actually, she might be here, Dr. Jane Van Dis, who's an OB. So she and the students are now meeting monthly with our hospital's CMO, Dr. Apostolakis, to talk about sustainability measures. And we're hoping to move the needle ever closer to having a central organization. And then back then, we didn't have a formal introduction to planetary health concepts. And now we do in the medical evidence and inquiry course that first-year med students are to take every year. They have a 1-hour lecture, and then it's also a part of their problem-based learning. Their PBLs have cases that have to do with things like heat stroke, heat exhaustion, poor nutrition due to changes in kind of crop production and yields. It's air quality for our home crit care person, Rachel, and how the wildfires are affecting people's COPD and asthma. So it's integrated it into their curriculum now. And we've also proposed for next spring a planetary health elective for people who really want to get in depth into these issues. So this was our sample curriculum that we've already started implementing. And with my last minute or two, I just want to introduce the planetary health elective that Dr. Weber had put together, because it was a tremendous amount of work. And I feel like it's a good outline for people who are hoping to create like kind of a senior seminar type of course. Okay. So for this elective, it would be something for 4th-year med students to take in that special time period after they know where they're matching. So they're not stressed anymore, but they want to gain additional knowledge on things in a way that addresses some of their more personal interests. So the objective of this elective, would be a 2-week elective, was to educate future physicians on the health impacts of climate change and also give them skills to be a successful physician advocate. So enhancing their communication abilities, evaluation, interpretation of scientific writing, and identifying allies. So sample activities. So we had identified a bunch of local leaders on sustainability and climate. For example, with our regional organization, the Climate Solutions Accelerator, to talk about mitigation measures. Also talking to our toxicology experts on environmental health issues. We also had arranged journal clubs and then tours with local organizations involved in sustainability. So there's tours that you can do with our local landfill to see like where our garbage goes, with the water treatment plants, and just really understanding what's happening with our waste in Rochester. And then we created a final project for them, which was in some sort of media form, translating a climate and human health topic for an audience, either a medical audience like we have here, or a lay audience. Basically, how do you become an effective communicator? And then drafting a proposal for a larger project based on identification of a local need. So this was a kind of a practicum, because we realized that a lot of planetary health education gives you knowledge of all the terrible things that are going to happen to humanity due to climate change, but doesn't give you any solutions. So the whole point of this was to be very practical and solutions based, and therefore the final project. So I'm going to summarize because I want to make sure I leave enough time for Rachel. Sorry, I'm going a little long. Currently, there's no LCME requirement to teach planetary health in medical school, which I think is a real shame, given that it's the largest threat to human health in our lifetimes. And only 52 medical schools provided any climate change education in required or elective courses in 2019. Hopefully it's better now. As of right now, there are very few curricula aimed at teaching students how to integrate this, but I hope by sharing our strategy, we can encourage other institutions to do the same. So I appreciate you guys taking your time after lunch to listen to me talk about it.
Thank you so much, Dr. Liu. And thank you for honestly highlighting like climate change can definitely be quite a doom and gloom topic, but you know, I really appreciate not just the call to action, but like the mobilization efforts that you mentioned in all of your curriculum development. Like if health professionals are empowered to make change, change will happen. So thank you so much. And we're going to move on to Dr. Wojcik, and we'll take questions for the two of you at the end.
Sounds great. Okay. Are we good?
Yes, looks good.
Okay, fantastic. So thanks everyone for joining today. My name is Rachel Wojcik. I'm a fellow at UPMC, soon to be faculty. And I want to talk to you a little bit about this project that I did for my master's in medical education, and it was around the topic of air pollution. The pictures here on the right are from the wildfires last year. So on the top is a picture from our medical ICU on a normal non-cloudy Pittsburgh day, and the picture on the bottom is from when the wildfires came through. So pretty dramatic, but even on a good day, Pittsburgh doesn't have that great of air quality, which is something I learned along the way. So for the agenda for this talk, I'm going to give you a little bit of the background motivation, go through the steps of how I developed the curriculum and our initial results and where we are going to go next. So I am getting my master's in medical education. I'll be finishing that up shortly. And I was trying to think of a project that I thought was interesting. And I have had the opportunity to go to so many beautiful places in this world. And I love being outside, like hiking and biking. And I thought, how can I combine that interest with something that's relevant for pulmonologists? And I thought, well, air quality makes sense. Because if we can't breathe the outside air, we can't do all of these amazing things and enjoy this beautiful planet. So that's really how I came to the topic, just kind of pondering while I was on vacation one time. And as you'll know, things kind of start off in unexpected ways. So once I had the idea for, okay, air pollution is a relevant topic to pulmonologists, and now I realize it's every specialty, but we'll start small. And I looked at the history of Pennsylvania, and there is a long history of poor air quality. For example, this little town outside of Pittsburgh called Donora had a smog event back in 1948 where 20 people died and 6,000 more were sick from a local plant that there was an inversion at that time. And so people got really sick and I think started to make people aware of air quality. And this is one of the sentinel events that helped contribute to the Clean Air Act. And then more recently, you guys may be familiar with the East Palestine train derailment. This is also not that far outside of Pittsburgh. This happened last year. There was a train carrying vinyl chloride that got derailed. And then there was a controlled burn to the extremely flammable nature of this, which we don't know like how much particles and exactly where they went to and what effect this has on communities. But these were two events that happened in our local area in the not too distant past. And so I thought, well, if I don't know about air pollution and kind of these historical things that are happening, then other fellows probably don't know either. So then I started looking like what is available at the fellowship level about air pollution. And currently there is no available curriculum on air pollution. So Columbia University had done a survey of health professional schools, and this includes like nursing and medical schools and PA, like all of them. There's about 50% of the institutions responded. About 63% had climate health education, although it wasn't required. But there was a lot of interest in developing curricula. So I said, okay, there's a need. We don't know that much about it. In fact, no one knows that much about it. And exploring even a little bit further, the Journal for Graduate Medical Education is calling for articles on climate and in graduate medical education. So a lot of the interventions are targeted at medical school, but what happens when our medical students get to the wards, get to be attendings? They don't have people that they can look up to give them some guidance. So I thought, we have a great bottom-up approach, but we also need kind of a top-down approach happening at the same time. And so there is a clear need. So this then brings me, I found the sweet spot of there's something I'm interested in, there is a need, it's highly relevant. So as you know, I'm going through my training in medical education specifically. So if anyone is interested in curriculum development, you will most certainly come across Kern's 6 steps for curriculum development. These are like, anybody who's in medical education knows about this. And it's a really great way to think about how you're going to develop a curriculum. So step 1 is the problem identification and general needs assessment. So I've actually already completed this step by telling you about the background for my project. And as you're thinking through curriculum development, you're thinking about like all steps 1 through 6 all at the same time, because they kind of move together and you're thinking at the end, at the beginning, and the beginning at the end. And it's a really lovely way, I think, to go through this. So we found our problem identification and general needs assessment. I will say I didn't do a needs assessment of our targeted learners. This was more in conversation with other fellows. They're like, I have never thought about air pollution before, except during the wildfires. That made it incredibly relevant, but most people hadn't thought about it before that. So I didn't do a needs assessment of the targeted learners. The other reason is because, some people may not find it relevant because they don't know much about it. And so I said, I think this is just something we have to do. So then I skipped to step 3, which is setting out our goals and specific objectives for the curriculum. So my goal for this curriculum was to increase fellow knowledge on the topic of air pollution. And so if that's my goal, my next question is, how will I know that I've reached that goal? And this is where a survey development came into practice, or came into being, I guess. So I wanted to make a pre-test that could then be compared to a post-test after the curriculum to see if fellow knowledge increased. So I also wanted to think, how would I display this on a poster? How would I put this on a paper? And it's very tempting to make a very long survey, but I really had to control myself. So I decided, along with some content experts and with literature review, to cover 5 topics in air pollution. These are incredibly broad, but that's where we have to start because no one knows anything about air pollution in my field. So I decided to focus on composition of air pollution, the health effects, monitoring, risk mitigation, and environmental justice. And then for each of those topics, I would have 4 questions for a total of 20 questions for my survey. The best thing you can do when you're thinking about creating a survey is see if one is already available and validated. That will make your life so much easier. But if that's not the case and you're in the same position I was, you're going to have to create your own survey. So some considerations when creating a survey, it's actually fairly complex, but it is totally doable. So step 1 is giving yourself months to complete this step. So if you get surveys in your email or people ask you to complete a survey, please do it because the creators of it have spent months and months and many revisions making that survey to get some really good information. So take the 5 minutes and complete that survey. We appreciate it. So 1, give yourself months to complete this step. Again, if there's already a validated survey, use that one. You want to make sure your survey, in my case, that it was testing knowledge and not an attitude or perception. Whatever survey you create, you want to make sure the questions are clear, that they can't be easily guessed by good test takers. So a lot of people in the medical field, we're pretty smart and we're really good at taking tests. So make sure the answers aren't easily guessed. Make sure there aren't compound questions. Can't have any leading statements trying to get people to get the right answer because then you're not testing knowledge. And then the other key thing is like, is this knowledge important for fellows to know or your learners to know? And can this information be retained? So these are all the things that I had in the back of my mind as I was creating this survey. And then it was revision, rewrite. So for example, one of my original questions was an AQI level of 101 to 150 corresponds with which activity recommendations for high risk groups. And I listed them all out. And honestly, it's not a bad question, but it's not a good question. And here's why it's not a good question, because it's not important for you to know this to this degree. You just need to know broadly, what does it mean for an orange alert? Maybe orange alert is where an action is set. So people should reduce prolonged outdoor exertion. So that's a better question. So thinking about our AQI, how can I make this more usable, more user-friendly? How can physicians use it to guide their patients a little bit? And so this question, it's better. It's more practical, it's clear, it's not easily guessed, and it's easy to remember. So we simplified it and said, at which level of the AQI is behavioral action set? And so that answer is at the orange level. So C is the correct answer here. And that's all you need to know. Is orange my high-risk patients? Maybe they shouldn't go outside. So we did that 19 more times to get my 20 question survey completed. So for example, indoor air HEPA filters are approved to remove which air pollutant from indoor air. This is good because patients, when we're making recommendations, might not know, and we need to be able to guide them. And the answer here is particulate matter, in case you were wondering. So after I created these 20 questions, went through the many revisions, I then piloted the survey. So I had a representative group take the survey. I actually had some fellows who very recently graduated go through it. I went through it with them question by question, assessing for clarity of the questions. Are they easily readable? Are they guessable? Does this seem at least a little bit relevant? And I got feedback from them and made modifications. And I finally had the survey ready for delivery. So I sent out the survey right before we started our first session on air pollution education. And as you can see, of the total responses for each group of questions, there were 76 responses. The correct answers are indicated in blue. And just broadly, what this shows is that there is room for improvement in air pollution knowledge for our fellows. In some instances, in some categories, it's about the same as guessing, close to 50%. So that made me happy because then I was like, well, not happy because I wish everyone already knew it, but it made me happy that there was probably going to be value in my curriculum. So then the next steps. So my goal was to increase fellow knowledge. I had a survey that said, yeah, fellows don't have a lot of knowledge and there's an opportunity for improvement. And the next step was implementation of the curriculum using medical education strategies. So I'm going to group these two together. So in thinking about implementing this curriculum, what was key about this is that I got to do it during already dedicated teaching time to fellows. So this meant that people didn't opt in or opt out, really. You had to come, unless you were on nights or vacation or things were crazy in the ICU. And it was nice. It wasn't an additional ask for participants. Like they didn't have to make any extra time in their day to come do this. And so I really appreciated, like Dr. Liu mentioned, getting support from senior faculty or directors is huge. So this was really great. It helped me probably get a lot more people involved than I otherwise would. The other key component is that I allowed for spaced retrieval. And what this means in the medical education world is that you have to allow for a little bit of forgetting in between sessions to actually increase learning durability. So we know cramming only works in the short term, not the long term. And so this picture on the left is the Ebbinghaus forgetting curve. So the first minute you learn something, you're going to start to forget it. But if you learn it again the next day, it takes a little bit longer to forget. If you learn about it again, it takes even longer to forget. And if you have this spaced repetition, you keep reviewing the material, it becomes stickier and you learn it a lot better. So we then had the opportunity to have 5 one-hour sessions spaced out over about 9 months. We started back in September with an introduction and ended this May with advocacy and environmental justice. And you can see at the beginning of each session, we had review. So this is where I did review questions to help prime people to start thinking about air pollution, recall information from prior sessions, and to really help make that learning sticky. What are our initial results? So now we're in the evaluation and feedback section of current 6 steps for curriculum development, answering our question, did our curriculum work? And so this is our preliminary results did show that there was an increase in knowledge, in fellow knowledge after the implementation of this curriculum. So the blue bars are for our pre-curriculum responses and our gold bars are for the post-curriculum. And you can see that in each domain that we talked about, there was a statistically significant increase in fellow knowledge, which made me feel very happy. I still have a couple people responded to their survey later, so we'll have to go over and hope that my results should stay the same. I think they will though. It's only 3 more people. So this was very encouraging. Feedback that I got, only one respondent had asked initially if anybody had had any education on air pollution, and only 1 out of 19 respondents said that they had, and it was a 1-hour session somewhere in medical school. Yet 85% of respondents had patients talk about air pollution during an appointment. Overall, the curriculum was well received. People said, this is great. I had no idea about all of this. And at the end of the day, people actually wanted more patient-focused materials and guides, because at the end of the day, we want to fix things. We want to see how we can help our patients. The challenge here is there's actually not a lot of great data. So I don't think people came to this with a doom and gloom attitude. I think they came with an open mind and wanted to learn. I also reinforced during the sessions that doom and gloom only benefits the industries and perpetrators of global crises and the climate change. They benefit if we don't stand up and say something. And so by starting off with like, listen, this is hard, but if we as doctors stand up and say something, that actually can make change happen. And so I think that was well received too. And so what are our next steps? So it's time for me to revise the content and questions. And I'll tell you, before I started this, I didn't know anything. And so one of the points I want you guys to take away from this is you don't have to be an expert before you get started. I found some content experts who could guide me, but I did a lot of self-education and a lot of learning and created something really cool. So observationally, there were some topics that are more high yield and well received than others. And I think I'll probably focus a little bit more on those. I have to revise a few of the questions of the survey. Now looking back, I don't like them that much, and I think they don't really add value. So I'm going to have to do some revisions there. I didn't assess participants' confidence in their answers, which could have given helpful information about the clarity of my questions, but it would have made the survey too long. And then for the content of each session, I'll also have to review and update this content as well. And my hope is then to be able to disseminate this to other institutions. There has been some interest, which is exciting. Certainly plan to publish this in any one of these journals. I'm working on writing this up as a manuscript. And then, yeah, like I said, disseminating to other programs, specialties, having faculty development. So there's, I think, a lot of opportunities for this to grow and evolve, and it will continue to be relevant, especially for all our patients who breathe. So thank you so much for listening to my curriculum and where we are. If you have any questions, my email's at the bottom, and I will turn things back over to Haley.
Great, thank you so much. And we're gonna transition right into our question and answer session. So Dr. Liu, there you go. Turn on your camera. Great. Thank you both so much for sharing your incredible curriculum and survey results with us. I'm really excited to see how both of your programs, kind of continue to develop based on everything that you said. And I wrote down some questions that I have for both of you, but to our participants in the chat, if you have questions for either of our presenters, please just write them in the chat and I can collect them. So I have a question for Dr. Wojcik. If you could describe, well, I mean, first off, I think it's really, really incredible, your survey results to kind of highlight the needs and knowledge gaps within the fellowship. And I was very shocked to see that kind of 50% correctness for all of those survey questions, especially with pulmonologists being kind of the primary target audience, as air pollution and wildfire smoke will impact that profession probably more so than any other medical specialty. But I'm just curious if you could describe maybe a bit more about the curriculum that was actually implemented there to see that kind of increase in knowledge.
Yeah, absolutely. I did a lot of the teaching myself because I was learning about it along the way. I did have one of the other things I thought was important. I had one of the community groups come in and give a talk also because they see things more on the ground than I do in the hospital all the time. So we had a group come in who work with the community. They have 2 lawyers actually on their on staff to help keep the environmental department in check. And there's a lot of organizations in this area that like Coke Works and old steel plants and things that are not very good about their emissions. So I had them come in and I thought it was really great. I actually kind of like to Dr. Liu's had mentioned actually I would love to take the fellows out to the community and be like, this is where your patients are coming from. This is what it looks like to live next to the Clairton Coke Works. So we had that. And then in addition, we had one of my mentors came in and talked about healthcare contributions to greenhouse gas emissions, climate change, and subsequently air pollution. And then I had somebody come in and talk about the environmental justice and advocacy component. So I really leveraged a lot of resources and made it, nobody wants to hear me drone on for an hour every couple of months. And it was really cool to hear from different people from different perspectives. So I tried to keep it variable and incorporate the local knowledge and experts.
Wow, that's great to hear. It's really interesting that you were able to so successfully bring in kind of community partnerships, because I think in the past, at previous sessions, I've heard from other institutions, other presenters, it's sometimes hard to, I don't know, find those connections for for physicians to be able to engage with, the participant population that they'll be serving outside of a medical setting. So that's really amazing. And I guess I have actually, we have a question in the chat another for Dr. Wojcik from Perry Morgan. Perry asks, I wonder/suspect that the fellows also had changes in attitudes and feelings as they prepared and activated to address these problems. Your goal and survey not only addressed knowledge, do you have plans maybe to address attitudes towards, air pollution and climate change, I guess, in general, maybe in your next iteration?
Yes. Yeah.
Yeah.
This was kind of our first time. This was I would say, a pilot
Mhm.
curriculum and survey. This is the first time we were doing it. So wanted to keep it kind of simple, or more focused. But yeah, I would love to ask for people's attitudes and perceptions. And I would love to hear how people like use this information during their patient interactions. So that's
Great.
for a future step.
Yeah, that's great to hear. I think there's also like maybe going back to what Dr. Liu was saying earlier, just like in her kind of survey of medical students in general, not just those that were interested in the planetary health report card. I think that sometimes, and I mean, I'm not a medical doctor, I have a background in public health, but I guess clinicians, I think sometimes they think of climate change as a bit of a public health topic and they don't feel quite so they can step into that role as like a public health physician. So I think it's really interesting, the attitudes question. I have a question here for Dr. Liu. I'm just wondering if you could, it's a bit of a two-pronged question. If you could talk about a little bit more of the kind of administrative response from your dean in terms of planning your like longitudinal curriculum, and also kind of what are the next steps with the curriculum development for the longitudinal program, and I guess like the Rochester Medical Center in general.
The initial response for administration was actually not helpful. So I had actually approached our medical center, I don't know, 6 or 7 years ago, as a faculty member, to say that, hey, this is a real need. And I wouldn't say it fell on deaf ears, but I mean, there's so many, again, competing interests, and it's just so much content that our medical students have to get in 4 years.
Right.
So it was really once the medical students themselves had said that this is something that's important to them, they had done a needs assessment, that actually got a tremendous response. That was the clutch, was getting our medical students helping amplify their voice on this issue. So that was part one of the question. Can you say part two of the question again, Haley?
Yeah. Sort of what are the next steps for the longitudinal curriculum? Like, how are you going to like adapt it and change it kind of going forward? I guess that's also kind of same for the elective. I'm not sure if that elective course is baked into your longitudinal curriculum or not.
So part of the issue is I'm sure as educators, you guys all feel the same push-pulls. There are so many hats that I'm being asked to wear and so many different roles that I have that I found it almost impossible to try to take on this 2-week elective on my own. So currently, our longitudinal curriculum is a lecture in their intern year, problem-based learning throughout their 2nd and 3rd years, and then on their 4th year, all our med students take a course called Successful Interning. And part of that course is kind of a talk and also small group sessions on planetary health and the practicing clinician. Basically, how do you get this verbiage out to patients, like Rachel's doing, counseling her patients on air quality in an effective way. I think the next step is trying to make that 2-week elective happen. But I'm still trying to identify other faculty members that can help me do that. We have colleagues in pediatrics and OB that are also really highly involved. But what we need from our administration is honestly like time and financial help. Because all 4 of us are like full-time clinicians. I have a full-time clinical schedule in addition to being an assistant program director for our residency, there's only so many hours in the day. So, you know, we've been trying to do it from the bottom up, but we also need some help from the top down, which the medical students have been helping us by saying what their needs are. But I don't know, it's changing year by year. You know, it's baby steps. And I think the monthly meeting that we have with our CMO has been helpful as well.
It's great to hear that the students have had such a critical role in kind of pushing the curriculum at Rochester. I think medical professionals, I guess health professionals in general, like their patients, like you were saying earlier, Dr. Lou, like climate change impacts are a current reality, but it will continue to kind of extrapolate and if impact your students' patient populations going forward. So I think they are highly motivated, but I think administrative support is I think the biggest challenge that I've seen from all of our sessions.
It actually is helpful that like now, so Cecilia Sorensen, who you know, Haley, has, she's creating questions for the step 1 exam.
Yes, yeah.
So, I mean, this is actually something that's getting tested on now, and that's all added ammo. So taking that information and putting it in front of our administration along with some potential solutions, that's been helpful is, you know, like Rachel did, like doing like a needs assessment, and then also having some prepared materials available and trying to put those pieces together, I think is the best way forward. But man, in administrative anything, change is glacial, is real slow.
Yes, no, I honestly couldn't agree more. But yeah, Dr. Sorensen, she is like currently writing questions on climate and planetary health education into that step 1 exam. Kind of just like even entering climate and health in like little entry points into medical education. Like I know it's very jam-packed, but I think there are places where it can, you know, be implemented. Oh, here, I have a question for Dr. Wojcik from Sheba, and several questions from Juan Julio, I believe that could be both of you could answer. So Sheba asked Dr. Wojcik, what was the pre and post questionnaire used, please? Do you have they already have a standardized questionnaire, or have you developed a questionnaire and is this a pilot?
Yeah, I made this one. I could not find one that served my needs. And so I had to make my own survey. It is not published yet, but I'm happy to share some of that. I have to change some of the questions too. They're not as, you know, pristine as I would like them. And that's just on my own reflection and learning. So that I just need to be edited because this was a pilot. I learned a lot this past year and need to incorporate some of that now looking back. So yeah, we had to make our own questionnaire.
Great. Yeah. And honestly, if you could share it with the consortium once it's published, we would love to share your survey as a resource on our website. And I personally have never seen a survey that quite so diligently assesses fellowship education specifically. So yes, please do share it with us.
Yeah, I would say it's like pretty basic. It could be implemented for like not even fellows. It could be
Really?
any, oh yeah, because we don't know anything. So we started off at the very basics.
Well, that's even better, honestly. And I liked your tip, always never try and reinvent the wheel when creating
Yes.
surveys. So, and this is kind of, this question's in Spanish from Juan Julio. So I hope my Spanish is not that great, but I put in a translator. Based on these experiences, what would be the next phase you would like to focus on? I'm assuming either following your survey results of like after the implementation, what's kind of the next steps there? If you have next steps, yeah.
Yeah. I had the opportunity to share my my preliminary results at the American Thoracic Society conference this past week, and there was a lot of interest from other institutions in expanding this curriculum. So my hope is that after I have polished, well, not even my hope, after I've polished the questions and the content a bit more, there have been several institutions that have already asked if they could kind of use the curriculum with their own learners. So my plan is to share it with whoever is interested. I have to figure out the details of that, how is the best way, and still collect data and all these other questions. That's something I'm thinking about. But yeah, definitely plan to disseminate it. We can't just keep this to ourselves.
Great. And we have another question from Juan Julio for you, Dr. Wojcik. Similarly, following the conversation about your survey, he asks, what's the difference between a perception survey and a knowledge survey?
It's just the quality of the questions. So knowledge is, like, what is the primary contributor to particulate matter in the atmosphere? That's not like, oh, I feel like it's this. It's like, it's burning fossil fuels, and that it has a specific answer. So that's a knowledge question. It has to have a correct answer. Whereas a perception is like, do you feel like this is important in discussing with your patients during appointments?
Okay.
So slightly different, and that the answers to that question could be varied. There isn't a right answer. I have a preferred answer, but there isn't a correct one per se.
Okay, that makes sense to me. I hope that answered your question, Juan Julio. And I guess I think we have time for maybe one more question, and I think this is just a question based like on my own interest. Speaking of perceptions, and this is a question for both of you. I'm wondering if like you had any kind of interactions with students like following your curriculum implementation, and like how they reacted to it, like after taking, your courses, and like having those interactions with the community, gaining those extra communication tools in their tool belt, hopefully bringing that C- up. So yeah, I'm just curious.
I've been really lucky to keep in contact with a lot of my students. So one of my first students I had on this was Dr. Weber, who ended up doing a fellowship on this and moving on to do a lot of work on it, which was fantastic. And I've had several other medical students go on to residency to pursue climate-related and sustainability-related quality improvement projects. So there's this concept of like QI, where it's these investigation, implementation cycles where you try to make change within your own hospital. So I've had students go on to residency and then do QI projects on biohazard waste and inappropriate biohazard waste, or like reclaiming hospital supplies. So, even in their very busy residency periods, they've been able to do some of this. And I feel pretty confident that once they're, practicing full attending physicians, that they can make this part of their dialogue. I think this is a big statement to make, but I'm going to make it. I really do believe that climate and health is like a paradigm shift in medical education, analogous to germ theory. I think back in the day, like you would have been looked at like a crazy person if you said there's invisibly small particles that are causing disease. But it's part of like every patient encountered, almost every differential that you have, the sick patient involves infectious disease and microbiology. And I think it's like that with climate and health. Not only is maybe this patient sick from a pneumonia, but maybe the increased humidity levels of where they're living are causing susceptibility to fungal disease. And I think it's really going to primarily shift how we think about disease and therefore how we treat it. And that's why I'm so passionate about it.
Sorry, my doorbell just rang. That's amazing to hear that your students were able to take the tools that they learned in the classroom and apply it to their residency program, like far beyond the classroom, and actually, feel like they could make change in their medical center. And I agree with you about your bold claim. And we're a bit over time, but Dr. Wojcik, if there's anything you have to add.
I think this is just the beginning for our group. I've had one fellow, first year fellow, she had her undergrad focus was environmental sciences. And she's like, I had no idea that I could combine pulmonology and my environmental sciences. She's like, that's so cool. There's so many questions we don't have answers to. And so that's really great that somebody's like, I could actually make this work for my own research. And I love when people text me like they see a town hall or this movie about air pollution. And, I hope they're not just telling me, I hope they're actually going and seeing it. But it's people are paying attention and they're hearing it and seeing it in places that they didn't hear it and see it before. So that I think is just the beginning. And I'm pretty excited about it.
Great. Great. Well, thank you both so much for sharing today. I honestly feel, and I'm sure others do on this call too, like, although this is just the beginning, like I do feel a lot more hopeful, especially having two like wonderful doctors like you behind the curriculum force in medical education. So thank you so much for sharing. And I'm just quickly gonna wrap up by letting you all know we will be taking a brief recess from the Member Learning Collaborative through the summer, but we will return with a session on September 26th that focuses specifically on some student perspectives, which were brought up today. So if anyone on the call is involved with any really active students in the climate and, health education space, regardless of profession, could be docs, nurses, public health practitioners, anything that would be interested in presenting at this session in September, please have them email me. I would love to get in contact with them. Any students that work for Planetary Health Report Card, medical students for a sustainable future, we would love to have them present. And lastly, just want to thank all the participants for joining us today. And I hope you all have a great rest of your day, evening, etc. And we'll see you next time. All right. Bye, everybody. Take care.